Good afternoon, and thank you for coming. I'm here to talk today about immunizations and the importance of providing your children immunizations. All parents are naturally concerned about the health and safety of their children. You know the importance of car seats and baby gates, but did you know the best way actually to protect your child is to make sure that they receive their vaccinations timely? I'm an emergency room registered nurse, and I also oversee the pediatric emergency department. And older illnesses are becoming much more prevalent now due to parents making the choice to not vaccinate their children. Immunizations have been proven to be safe, effective, and they not only protect your children, but also the children around them. Immunizations can save families time and money, and also protect our future generations. We must immunize our children. Illness and death can be caused by many of these infectious diseases, which we have almost eradicated with the invention of vaccines. And these illnesses are easily preventable by vaccinating your children. And it's a proven fact that vaccines prevent illness. Many of the diseases that we vaccinate our children against can be deadly. It's important to follow the CDC regulations for when to vaccinate your children and make sure that they're always up to date with their vaccinations. There's many medical implications to not getting vaccinated. It's important to share with your healthcare providers if your children are not up to date with their vaccinations, because they receive distinctive treatment as opposed to those who are vaccinated. You also have to worry about the people around you that you affect if your children are not vaccinated. For an example, a woman who is pregnant and her fetus does not have antibodies as of the point when the fetus is in the womb. So a pregnant woman who contracts rubella, even though she may be immunized and be able to have antibodies against that virus, her unborn fetus is not. And contacting rubella for the fetus could cause many major birth defects. It could cause deafness, heart defects in this unborn child. There's also social implications for not vaccinating your children. Most schools and daycares now mandate that you supply an up-to-date active vaccination list in order to be enrolled in the program. If your child is not vaccinated and becomes ill, they actually need to be quarantined until their illness can be diagnosed. And that's to keep the other children from not getting an illness. How vaccines work. Vaccines actually help the body by imitating an infection. When you get immunized, you're actually injected with a weakened form of the disease, which triggers the body's immune system to produce antibodies to that virus. And vaccines prevent the body for the future, so that after you maintain these antibodies in your body, if you're ever to come in contact with that illness in the future, your body's prepared to fight the infection. Vaccines work in many different ways, but ultimately preventing the contraction of many deathly illnesses. Vaccines not only protect you, but also protect the people around you, which I mentioned earlier. Disease prevention is key to public health. It's better to prevent a disease than to treat it. And so obviously being proactive being vaccinating your children, then reactive, meaning treating your children whenever they contract this disease that could have been prevented with the vaccinations. Vaccines are responsible for the control of many infectious illnesses. Illnesses such as polio, measles, diphtheria, pertussis, rubella, mumps, smallpox, tetanus were once very prevalent in the United States, and these were devastating illnesses, many even causing death. And another big question to ponder is, what would happen if we stopped vaccinating? Several things. Vaccines have significantly reduced the amount of vaccine-preventable diseases. And so by stopping vaccinations, we could see a return of these diseases. Polio could return to the United States. Polio is a detrimental illness, which can cause paralysis and lead to permanent disability or even death. We could see an outbreak of measles. Prior to immunizations, nearly everyone in the United States developed measles, many resulting in death. We could see a return of meningitis type B. Since 1987, when the vaccine was discovered for meningitis, we've seen the incidence decrease by 98%. So that's obvious that the reason for the decrease was the invention of the vaccination. Newer vaccines such as the pneumococcal vaccine, the varicella, which is chickenpox, hepatitis B, influenza have been essential in keeping people healthy. Many daycares now will not allow you to send your children there without an up-to-date influenza vaccine because it's a very highly contagious illness and can be debilitating for not only the child, but the children that they're around. It's essential that we keep ourselves and our children up to date with our vaccinations. There's a reason why schools mandate and daycares mandate that a child be up to date in the immunizations, because it's proven that those who do not choose not to immunize their children put everyone else at risk. And it's essential that we do everything that we can to protect our children. Wouldn't you want everything in your power to make sure that your child receives a heart donation if they had a life-threatening heart anomaly? Then why would you not give your children immunizations that could avoid your child from contacting a potentially life-threatening illness? And that's a good question to ponder, because if you would save your child's life that way, why would you not save your child's life and be proactive by vaccinating? So thank you for listening. Any questions, I'm available afterwards, and have a great day.